We get a lot of questions from veterans asking whether PTSD and high blood pressure can be medically connected. The answer is there is a real medical conversation here, but it has to be explained carefully. This is one of those conditions and topics where people sometimes oversimplify, and I just want to go into a little bit more detail to try to explain why it's not that simple. So you may hear someone say, PTSD causes hypertension, as if it's an automatic connection, and that's just not true. Or you may hear high blood pressure is common, so PTSD has nothing to do with it. The opposite argument, and again, not true. Both of those statements are too simplistic. Hypertension, which is the medical term for high blood pressure, is a complex medical condition that can be influenced by many factors. Those can include factors such as age, genetics, weight, sleep quality, medication effects, stress, kidney function, your lifestyle choices, and other medical conditions. So the question is not whether hypertension can have multiple causes. It can have multiple causes. The question really is whether PTSD can medically contribute to the development or worsening of hypertension in a particular veteran's case. That's very important. That particular veteran's case, these are unique. You cannot do a one-size-fits-all with these things. That's where the evidence really matters. PTSD is not just a mental health diagnosis. It affects the body's stress response to systems. So it can increase something you might have heard of, sympathetic nervous system activation. That's your fight or flight response. It can affect sleep. It can increase your stress hormones. And there's an entire pathway of what increasing your stress hormones does to your body. Worse than hyperarousal. And it can contribute to long-term physiological strain. So from a medical standpoint, it's reasonable to explore whether chronic stress and those mechanisms related to chronic stress contribute to elevated blood pressure over time. Often you'll see the VA recognize acute elevations in blood pressure, but chronic elevations are associated as well. So this is also where a good medical opinion has to be disciplined. A strong opinion does not say PTSD always causes hypertension, because that's not true. A stronger opinion, something more like PTSD is medically capable of contributing to sustained blood pressure elevation through chronic stress physiology, poor sleep, autonomic activation, or other related pathways in this veteran. Very important, in this veteran. The timing, the symptoms, the history, the severity, and the overall record make that relationship medically plausible. And it's at least as likely as not in support of that aggravation theory. So there's a much better framework and much more detail for you to explain how that connection makes sense between those conditions and for that particular veteran. It's important to understand the difference between association and causation. Association means two conditions are seen together more often. We often see private nexus letters fail because they'll cite research that only shows that association. Causation means one condition actually caused another. It's very rare that you'll find that because there's lots of factors. Medicine is gray. It's not usually one causes another. So medical research may show that association between PTSD and hypertension, but the veteran's specific opinion still has to explain why that research applies to the individual case. That's where the medical records matter, and a good nexus letter company will actually be able to do a better job because they're connecting those dots. A stronger analysis may look at when PTSD symptoms began, when the hypertension developed, whether sleep disruption or chronic stress was significant, and what other risk factors existed. You want to look at whether the PTSD may have worsened that blood pressure picture, even if it did not solely cause it, and how. It's a very complex argument, and not everybody can do it successfully, and not everyone takes the time, which is what it takes, a lot of time, to analyze all these facts and put it all together. This brings us back to that aggravation argument. Sometimes the strongest opinion is not PTSD caused hypertension. sometimes, and most of the time, I'd say, PTSD likely aggravated the hypertension beyond the normal progression. You have to prove that beyond the normal progression with the medical records. That matters because aggravation is a valid pathway when it's medically supported. Again, not one size fits all. This doesn't apply to everyone, and you need to get your documentation aligned. This is one of the reasons veterans get confused. They think if there's any other risk factors, the connection is dead. That's not always true. Medicine is very frequently and more often multifactorial, meaning several factors contribute to it at once. And you really need to tease out all of those factors. So it's important to have all of the evidence. Give me everything. That way we can determine whether the evidence supports that PTSD is one meaningful contributing factor in your case. If the record shows severe chronic PTSD symptoms, significant sleep disruption, long-standing hyperarousal, and blood pressure patterns that fit or failure for treatment that fits that clinical picture, it may support a stronger opinion and then something that just says list generic risk factors and stops there. The key is individualized reasoning. This is important for almost any Nexus letter. Not slogans, not shortcuts, not broad claims that every PTSD diagnosis equals hypertension or something similar. It's not a one-size-fits-all. What works is medically specific reasoning that explains why the relationship makes sense in this veteran's case. There are no shortcuts. If you're trying to understand whether your PTSD and hypertension records tell that story clearly enough, the right next step is to look at whether the timeline or the symptom history or the risk factors and the aggravation analysis are actually documented in your medical records in a medically useful way. If not, you may need to see your doctor and explain a little bit more about how that condition impacts you and what's been happening. You just may need to have a little better conversation with your